Okay. Alright. So, let's see, the other day we stopped here. So, we have the thoracic cage and the sternum here. So, we have the manubrium, the body, and the xiphoid process. We have the first 7 ribs. Those are your quote-unquote true ribs. We don't use that word anymore. We call them vertebral sternal ribs because they attach from the vertebra directly to the sternum. Okay. 1, 2, 3, 4, 5, 6, 7. First 7. 8, 9, and 10. 8, 9, and 10 are called your vertebral chondral ribs. They attach into the cartilage of 7, which is right here, and then come on up. The last 2 are your quote-unquote floating ribs. Again, we don't call them that. They are your vertebral rib 11 and vertebral rib 12 because all they do is attach to the vertebra itself. When we look at the vertebra, we have a typical lumbar vertebra, typical thoracic, typical cervical vertebra. How do I know? One of the big things is cervical vertebrae are the only ones that have the transverse foramen. Okay? Everybody has a vertebral foramen. Okay? But in the transverse process, the only one that has a hole there is the cervical vertebra. Okay? Here's the transverse process for the thoracic, nothing there. Transverse process for the lumbar, no hole there. Okay? Only found in cervical. Aside that little difference, the other difference between cervical, thoracic, and lumbar is the spinous process. Spinous process in a cervical vertebra is bifid, which just means it's toothed. So it has a little bitty depression that exists in between the 2 sides of it. This one's been rubbed down after 20 years, so you don't see that very well. But bifid means toothed. All it does is increase the surface area for all the muscles that attach here in the neck, of which there are many of them. The spinous process for the thoracic vertebra is imbricated. Okay? So it kind of hangs over the next one, kind of like shingles on a roof. Lumbar, short, stubby, boom, right there. It's always big, it's always small. This one has to hold up more weight, so it's more bigger. Okay? Vertebral body, vertebral body, vertebral body. C2 and C1 do not look like a typical cervical vertebra. They're vastly different. C2 has the dens right there. And you can see C1 has these 2 kind of lateral masses associated with them. Still have a still have a transverse foramen, still have a transverse foramen, okay? But obviously very different from a typical one. And I'll just put typicals on the exams. Okay? I won't put one in the transition zone from one zone to the next. Transitioning from cervical to thoracic, those first couple there can look like one and another. So, sacrum and coccyx. Sacrum, coccyx. As we head down, we have the clavicle. That's not to be confused with that. Okay? We don't have a baby clavicle. Okay? Sometimes people call it the baby clavicle. We don't have baby clavicles. Okay? That's the first rib. This is your clavicle. You can see it looks nothing like it. Okay? So if we look at the clavicle, we only have 2 things, the 2 ends. We have the acromial end. That's the lateral end. You can see it's much more flat. And the sternal end is much more boxy shaped. Sternal end box, acromial end flat. Here we have the scapula right here. Here's the front side, here's the back side. When we look at it here, the first thing we see is the spine of the scapula. It's this big thing right here. From the spine of the scapula, we can go above and below it. A shallow little depression above, a shallow little depression below. This is the supraspinous fossa. And here's your infraspinous fossa. We have another shallow depressive area, and that's here on the front. It's called the subscapular fossa right here. Why is it called sub? Sub means below, and this on the anterior surface. What? If you put it in an anatomical position here, I'll put it over here. Okay? And in anatomical position, this is the below surface. Okay? That's the below surface, the anterior. So that's why they call that one subscapular fossa, even though it's on the front. We have two processes, the chromium process right there, and the coracoid process right there. And then we have the glenoid cavity right there. Here is the humerus. Here is the humerus. Backside, front side. Backside has your trochanters. Sorry, tubercles. Front side or backside has the big hole in the back. Okay? Backside has the big hole. So here we have the greater and lesser trochanters, bigger and smaller, greater and lesser. We have the head of the humerus right here. Out here on the lateral aspect, and this has to point medial, so you know if that's pointing medial, this has to be lateral out here. And out here on this side, right around here, you see kind of a little bump that exists right there. That little bump right there is the deltoid tuberosity, one of the attachment sites for the deltoid. Then if this is pointing medial, then that has to be the medial epicondyle, and that's the lateral epicondyle right there. It's where all the tendons for the forearm attach into, right there in that tiny little spot. Next up is the radius and ulna. Okay. Here's the ulna. There's that little wrench. And here's the round head of the radius right here. Okay. So if that's the head of the radius, the other structure that you have to identify is right there. That's the radial tuberosity. Here is the ulna. We have three things. 1, 2, and 3. 1, 2, and 3. We have the olecranon process right here. We have the coronoid process right here. And then in between them, we have the trochlear notch right there. Here is the hand, back side, front side. Okay, so there we go. We have the carpal bones are right here. They make up the wrist. Okay. So that's where they are. There's a proximal row and there's a distal row. There's 2 rows of them. We have the palm of the hand here. Those are going to be your metacarpals. 1, 2, 3, 4, 5. And then the phalanges, your fingers. Okay. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2. Phalange number 1 has a proximal phalanx and a distal phalanx. Digit 2 here has a proximal, middle, and distal phalanx. Digit 3 has a proximal, middle, and distal phalanx. 4 has a proximal, middle, and distal phalanx. And 5 has a proximal, middle, and distal phalanx. So 5, 4, 3, 2 have a proximal, middle, and distal phalanx. Digit 1 only has a proximal and a distal. If I go back down here to my hands, to my carpals, sorry. Here's my proximal row. Right there. And then here's my distal row. Scaphoid, lunate, triquetrum, pisiform, trapezium, because you need your thumb to grab the trapeze, trapezoid, capitate, hamate. Some lovers try positions that they can't handle. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Here is my hip. your os coxa. It's the fusion of 3 bones. One that you sit on right here that I'm holding, the ischium. In the front, where I'm holding the pubic, and everything else, the ilium. If we just look at the one in the front right here, here is the pubic bone, okay? And here's the pubic symphysis right up front here. A little fibrocartilage pad sits in between the 2 sides of your hips. The ischium is the one in the back. Here's that bony protuberance right here. When someone says you have a bony butt, booyah, that's what they're talking about. It's the ischial tuberosity right there. Aside from the ischial tuberosity there, we have a hole, as you can see. It's the obturator foramen. We have a little notch right here. Okay, we have a little notch right here. That is the lesser sciatic notch. If I go up, here's the big one. There's the greater sciatic notch. There's the greater sciatic notch. There's the lesser. Smaller, much bigger. Greater sciatic notch, lesser sciatic notch. So we continue on up. There's your acetabulum. And that's got a point lateral, so there you go. So here's the front. Here's the back. This little depression right here. Do I have that down here? Do you guys need that? Yep, iliac fossa. Right here, this little shallow depression. The iliacus sits right in it. When you put your hands on your hips, you put them on the iliac crest. In the front, you have 2 bumps. Anterior, superior, iliac spine. Anterior, inferior, iliac spine. Same phenomena exists back here in the back. Posterior, superior, iliac spine. Posterior, inferior, iliac spine. There is your femur. Big, massive bone. We have the head of the femur, obviously. If you look at the end of the femur, there's a little shallow depression right there, a little hole. That is called the fovea capitis. I believe the book just calls it the fovea, I think. So either one would be acceptable. We have the greater trochanter, which is really big, and the lesser trochanter that's really small. Stay on the back side there, and we head on down. You can see this little ridge of bone right down that center aspect of it. That is the linea aspera. And the last thing we have to do are the condyles, and they are right here. We have the medial and the lateral condyle. Put it back in anatomical position. There's your medial condyle, and there's your lateral condyle. Here's the patella right there in all of its glory. Sometimes I just throw that out and ask you to identify it. It's the patella. Sometimes I have it on the articulated model over there on the model. Those full spine guys. Next thing we have are the tibia and the fibula. Just kind of like that. If I look at the fibula first, it's the most lateral bone. We have 2 parts. We have the head that I'm gripping right down here. And then distally, we have the lateral malleolus. Bump on the outside of the ankle. If we look at the tibia, we have the condyles. We have the medial and the lateral condyle. We have the tibial tuberosity right there. And then as we go down distally there, that bump on the medial aspect, there's your medial malleolus. Last thing we have is the foot. Just like in the hand, we have the same kind of setup here. We have phalanges, we have metatarsals, and we have all of our tarsal bones here. Just like in the hand, we have a proximal and distal for 1. And just like in the hand with 2, 3, 4, and 5, they have a proximal, middle, and distal phalanx for each of them. just like in the hand, the metacarpals were 1, 2, 3, 4, 5. Same thing down here with the metatarsals. 1, 2, 3, 4, 5. For the tarsal bones, the two biggies that we looked at today, we looked at the talus and the calcaneus. The other one are the medial, intermediate, and lateral cuneiform bones. They help form the arch of your